Hi, my name is Jillian, and I'm going to be talking to you about a research article by the name of Leadership Strategies to Reduce Employee Turnover in the Healthcare Industry. This is a dissertation that was written by Sheila Redmond. Her problem statement is that in 2018, over 3.1 million people left their positions in the healthcare industry in the US, and the turnover was a significant burden financially on the healthcare industry, and the leaders of the organizations were lacking the knowledge that they needed in order to reduce the employee turnover that was happening. The significance of this research is that reduction in the turnover means that there's less financial burden on the healthcare industry. There's increased ability to provide patient care. There's a reduction in employee stress, improved employee morale, improved employee relationships with family, and increased spending in the community, which supports economy. The research question that Sheila focused on was what strategies do healthcare leaders use to reduce employee turnover? The literature review that Sheila did was focused on transformational leadership theory. She explored several leadership theories to determine which theoretical framework fit best for her particular study, and she decided on transformational leadership theory. This is a leadership theory that is recognized as the most widely used to influence organizational behavioral change. It was first introduced in 1973 and then was further developed in 1978 by J.M. Burns. The definition that J.M. Burns provided was that it is a conversion of a small group of people into moral agents who stimulate employees for higher cause. Transformational leadership works to increase employee engagement, influences organizational change, and energizes, engages, and empowers employees, which in turn reduces employee turnover and increases employee retention. It encourages individual talents and increases personal growth. All things that it theorizes will reduce employee turnover and increase employee engagement and employee retention. The research methods that Sheila used was that she did a qualitative single case study in which she did a semi-structured interview with 5 different leaders from one healthcare organization in Virginia. These were all leaders that the Human Resources Department of that particular organization identified as leaders who had been successful in retaining employees and reducing employee turnover for their particular departments in their particular organization. She did a closed interview with these leaders. She was in her home office with the door closed and headphones in to maintain the confidentiality of the people that she was interviewing and the information that she was gaining. All of the interviews were recorded and they were transcribed. A copy of the transcripts were provided to the leaders. The leaders and the leaders who were the participants of the study, so that they could look at the transcripts and make sure that the information that was provided and for the research was accurate, and also what the leader intended for the research to focus on. It was the information so that they could provide the information that they felt like was the most important, and make sure that what they said aligned up with what they were trying to convey. So from the transcripts that were provided, or transcripts that were created from the research, the data was extracted and themes were extracted from all of the interviews that Sheila conducted. So then we move on to the results and the analysis of the raw data that was extracted from the interviews. So Sheila used a software called, I'm sorry, I don't know, I'm not familiar with this particular software. So it's NVIVO 12 software, maybe NVO 12 software. um, this is particular software that's used for this type of research, of interviews and transcriptions. It is software that has the ability to classify, sort, arrange information, and examine relationships within the raw data. Very cool. The themes that were extracted from the raw data from the interviews that Sheila conducted. Oh, by the way, the interviews were no more than 60 minutes long, and she had a list of 5 different questions that she used to interview the leaders with, and then she continued the conversation until it felt like she had extracted all of the information she possibly could on this particular subject, but none of the interviews lasted more than 60 minutes. The themes that were extracted from the raw data that the participants shared were successful in retaining employees were an increase in work-life balance, a focus on work-life balance and an understanding of it, employee engagement, training opportunities, and job satisfaction. And then job satisfaction was further broken down, which was helpful to me because I was like, what does job satisfaction even mean to these particular people and these leaders that were interviewed? And so it's trust, flexibility, engagement, opportunity, and salary, which makes sense to me. If I'm in my job and I have trust, flexibility, engagement, opportunities, and a satisfactory salary, I'm probably going to stay in that particular job. So moving on to the discussion that Sheila shared with us, she reiterated that employee turnover is a significant cost for all organizations. Anybody that has been involved with organizations in this way knows that turnover is a big deal. It's difficult to replace employees, and it is expensive to replace employees. And the findings in her research suggest that turnover can be reduced by instituting organizational change of increase in the 4 themes that emerged. And just to recap again, the 4 themes are work-life balance, employee engagement, training, and job satisfaction. So employing those 4 themes that emerged, which also align with transformational leadership theory, that we can that the healthcare industry can reduce employee turnover, increase employer retention, and improve finances, improve morale, improve. This is anecdotal for me, but because this is not what Sheila said, but to improve productivity of employees. So the suggestions for leaders that was produced by this particular work of research was that in order to improve retention of your employees, using transformational leadership theory, which means to understand the need for work-life balance for employees, acknowledge employees' achievements, encourage and provide trainings to your employees, and show trust, empathy, and provide inspiration to employees. So moving on to limitations of this particular work of research is that there was a limited degree of information that the leaders were willing to or felt like they were able to provide to Sheila in the interviews based on their comfort level and what they felt like their organization would be okay with them sharing. The participants were only from one organization in one state, and so it's not known for sure that that can be transferable to other organizations, other employees, other healthcare industries in other states. There was restricted access. So the HR department put restrictions on the access to the leaders in the organization Sheila didn't have access to all of the leaders in the organization. HR provided her access to a specific set of leaders only, which means that it reduced her the exposure to additional information that might have been gained, might have improved the results, meaning that the results would have been richer. Not necessarily that it would have changed the results, or the results themselves would have been better somehow, but richer, more information. And like I was saying, it was only from one healthcare organization, and it wasn't other healthcare organizations. So the organization that she focused on, I believe, was a medical facility. I think that it was a large hospital in Virginia with leaders within it, obviously. And so it didn't cross over into other healthcare industries. And obviously there's many other healthcare industries besides medical. I myself am in the healthcare industry, but I'm in the mental health care industry, which is different than being in the medical healthcare industry. And so it was only with medical healthcare, not any other type of industry within the healthcare systems. And so it was limited in that way. So her recommendation, the research recommendations are to use transformational leadership techniques to improve retention of employees. And there was a focus on improving work-life balance and recognizing the need for work-life balance for employees, and the things that an organization can do, leaders can do to recognize the need for work-life balance for employees is to provide on-site daycares, provide flexible schedules, flexible work schedules, provide the ability to work remotely. I'm assuming that means work from home or telecommute, and provide commuter subsidies for those that are commuting physically to the job site. So in conclusion, this is both Sheila's information and a little bit anecdotally my own. Happy employees with less stress do better work and stay in their jobs. More time with their families, with growth opportunities, the ability to be trained and training opportunities. It's more likely for somebody to stay in a job if they're provided those opportunities. Loss of healthcare workers has a significant negative effect on our healthcare industry. It reduces our ability to provide quality care to the patients that are in need of care. And there's a significant cost to organizations to have employee turnover. So that is the conclusion of my sharing of this particular dissertation by Sheila Redmond, and I hope this was helpful information and interesting, and thanks for listening. Bye.